Om Swastiastu. We are from SGD B1 from PSSKPD 2020 third semester. In this occasion, we would like to present our student project with title Management of Iron Deficiency Anemia. My name is Putri Devi with 3 last digit numbers 002. We'll start the presentation. And here is our group's members. And this is our contents for today's presentations. And I will start from background. Anemia is a condition where the hemoglobin level in the body is below normal according to the age and sex of the individual. One of the components that form hemoglobin in the blood is iron, in which its decreased values can be associated with reduced iron availability in fulfilling body functions. Iron deficiency anemia is a common cause of anemia in the world, in which to diagnose it, laboratory tests are needed as a supporting test because the symptoms are non-specific. The global prevalence of patients with anemia condition reaches 1.7 billion people, with cases caused by iron deficiency reaching 50 to 80% of the total. Risk factors for IDA itself include age, gender, occupations like athletes, and history of inflammatory bowel disease. And the common etiologies of IDA are blood loss or bleeding and low iron absorption due to insufficient intake of iron. So the problem formulations are: what is the epidemiology, what is the pathophysiology, what are the etiology, what is the diagnosis, and what are the treatment and managements for iron deficiency anemia. And the purposes of our writing is to answer the problem formulations, and our benefit of writing is to give general knowledge about iron deficiency anemia and specific knowledge about the management of iron deficiency anemia. That's all from me. Thank you.
My name is Bertrand Maylenzky Wijaya, and I'm going to explain about the epidemiology. Anemia can be caused by a variety of factors, but iron deficiency anemia, or IDA, is the most common, accounting for 50% of all cases. In 2010, approximately 1/3, or 32.9% of people worldwide had anemia. Next. Okay. The prevalence of IDA varies a lot depending on age, gender, physiological, pathological, environmental, and socioeconomic factors. However, in 2016, the most vulnerable demographic groups to anemia were children under the age of 5, 42%, particularly infants and children under the age of 2. Women of childbearing age, 39%, and pregnant women, 46%. Females were consistently more at risk of anemia than men in the absence of bleeding across practically all geographic regions and throughout most age categories. That's all for epidemiology. Thank you.
Okay, my name is Bagus Manuaba with a student number 20025112010. Today I'm going to explain about the pathophysiologies of the iron deficiency anemia. Iron, a micronutrient required for life, is especially crucial for the proper development of red blood cells, thus transporting oxygen throughout the body. Iron metabolism is closely regulated throughout the red blood cell cycles of life. Even though EPO controls the erythroid lineage development from multipotent myeloid stem cells, the conversion of erythroblasts to reticulocytes associates the presence of iron, which means the iron deficits will reduce EPO response. Macrophage phagocytosis is of damaged RBCs and iron recyclings, a process regulated by EPO refills the majority of the iron storage. Hepcidins, an iron metabolism regulating hormone, is produced in response to increased iron intakes, inflammations, and all sorts of infections. Hepcidins maintains the systemic iron homeostasis by binding to ferroportin, the only known channel for iron export and multi-domain transmembrane protein, which is abundant in cells that handle iron such as duodenal enterocytes, splenic red pulp macrophage, and hepatocytes. Hepcidins bind Hepcidin binding inhibits both absorption and recycling of ions, therefore reducing the iron fluxes in bloodstreams. Next.
Hello, my name is Chandra Putri with my last three digits of my student ID number is 168, and I will explain about the etiology. So the first etiology is dietary factors. So compared to omnivorous diets, those who apply vegetarian diets could have a higher risk of iron deficiency. French products contain non-heme iron, so non-heme iron has low bioavailability. The second one is hemorrhage. So hemorrhage can cause acute anemia due to its direct loss of red blood cells. So, for example, Helicobacter pylori gastritis may also cause iron deficiency anemia due to microaerasions that can cause GI bleeding, and also bacterial competitions that affects the dietary iron absorption. The third one is hemoglobinuria. So the urine specimen may appear bloody, with the laboratory examinations results show hemoglobin. Hemoglobinuria is associated with paroxysmal nocturnal hemoglobinuria or intravascular hemolytic anemia. The fourth one is malabsorptions of iron. So, for example, autoimmune gastritis caused by the destruction of parietal cells may lead to malabsorption of iron and vitamin B. And also, patients with achlorhydria means that the body is unable to produce hydrochloric acid, which leads to iron deficiency. And the fifth one is pregnancy. The iron requirement in pregnancy increases significantly than in non-pregnant women. This happens to meet the increased demands of the fetal-placental unit, expand maternal red blood cell mass, and also to compensate iron loss during the delivery. That's all from me. Thank you.
Thank you for the opportunity. My name is Amadeus Fernandito, Leksana, and I will continue the explanation about the diagnosis. First is about the signs and symptoms. Iron deficiency anemia is a disease with mild to severe clinical manifestations. The high severity of IDA will worsen the sign and symptom that arise in a person. Based on this statement, it can be concluded that the signs and symptoms of IDA are directly proportional to the severity of the disease. Generally, several signs indicate that a person suffers from iron deficiency anemia, include dry and brittle nails, spoon nails, or koilonychia, paleness of the skin or yellow skin, afternoon tongue, and cracks around the lips. The appearance of some of these signs is also accompanied by the development of symptoms that characterize people with IDA. Some clinical symptoms of iron deficiency anemia includes chest pain, shortness of breath, cold extremities, tongue soreness, tachycardia, headache, exhaustion, sleep disorder, tingling feeling in the legs or restless leg syndrome, alopecia, and whooshing in the ears and pica. Pica is a type of disorder in which sufferers crave something that cannot be consumed or has no nutritional value, such as clay, dirt, scratch, and ice. That's all from me. Next one will be presented by my friend.
Hello everyone, my name is Stevanus Surya with last three digit number is 15. So now I will explain to you for the diagnosis criteria of iron deficiency anemia. The diagnosis of iron deficiency anemia is based on three steps, namely anamnesis, which health workers will pick up information by asking about risk factors related to the development of the disease, such as symptoms experience, drug history, family history, genetics, and environmental factors. The next step is physical examination to identify bleeding in the body, to examine the nail abnormalities such as brittle and koilonychia, and fingers to examine the speed in blood refilling. The next is to check the heart rhythm, to identify tachycardia, to check the patient breathing rhythm, to perform an abdominal examination to examine any other organs such as spleen and liver, perform a checkup on the tongue, mouth, and hair to detect abnormalities such as afternoon tongue, crack around the lip, and alopecia. The last one is to identify any abnormalities on skin color,
such as yellowish skin. The last one is a laboratory examination to support the analysis and the physical examination. Complete blood count is a test that has become a gold standard in diagnostic abnormality in blood. On complete blood count examination, several blood components are assessed, namely erythrocyte, leukocyte, hemoglobin, hematocrit, and thrombocyte. To support complete blood count, several other tests that can be performed, such as tests to assess the iron level, tests to assess the shape and the size of erythrocyte, serum ferritin level test, and KIBC test. The KIBC test is aimed to assess the transferrin level that carries iron. That's all from me. Thank you.
Hi, my name is Christian with name 102, and I will continue with recommendation treatment for IDA. So in IDA, the target is to recover HB concentration and RBC count to normal level. IDA treatment must be done and have been proven to improve patient quality of life and alleviating common IDA symptoms. The most common and cheapest way to treat IDA is by oral road ferrous sulfate, 200 mg twice daily. Other iron compounds such as ferrous gluconate, ferrous fumarate, iron suspension could also be considered if ferrous sulfate intolerance is present. Although inexpensive, iron absorption in intestine is quite limited with only 20 to 25% absorption rate of 100 mg oral iron at maximum. Intestinal impairment or abnormal intake in certain conditions such as bowel surgeries, bariatric surgeries, gastrectomy surgeries, and other conditions may need parenteral therapy. Parenteral preparation that are available are sodium ferric gluconate, iron dextrate, iron sucrose, iron vermicetols, and ferric carboxytols. Administration of this parenteral iron must be done in controlled environment setting to reduce fatalities that may arise from serious adverse effects. Thank you.
Hello, my name is Pratama with 3-digit student identification number 061. This presentation, I will cover about clinical trial treatment, decide the recommendation treatment for iron deficiency anemia. There are 2 clinical trials that I will present, first from Rosen et al. And second from Widya. The first, Rosen et al. 2019, suggests use of probiotic to enhance iron absorption in pediatric with iron deficiency anemia. The result was increased ferritin level in all children taking the probiotic after 6 to 8 weeks of treatment. But there was no significant difference between the intervention group and control group. Second, from Lee et al. 2020, search for meaning of use of vitamin C compared to iron supplementation only on patients with iron deficiency anemia. This clinical trial, all adults with newly diagnosed of iron deficiency anemia were enrolled, and the result was measured on hemoglobin level in the intervention group and control group. At the 2 weeks of treatment, there was 0.16 difference between the intervention group and control group, and at 4 weeks, there was 0.22, 6 weeks, 0.20, and 8 weeks, 0.13. The conclusion of this clinical trial that iron supplementation only were equivalent to iron supplementation with vitamin C in a patient taking for treatment iron deficiency anemia. There are from my presentation. Thank you.
Okay, my name is Madikana Devi and I want to explain about the factor influencing absorption and bioavailability of treatment. The first is absorption of heme iron. Heme iron is produced from hemoglobin and myoglobin, found in fish, meat, and poultry. Heme iron accounts for 10 until 15% of dietary iron consumption and only absorbs about 15 until 35%. Heme iron absorption is affected by a small number of dietary variables. Calcium decreases heme iron absorption, but meat and soy protein increase iron absorption. If meat is cooked for a long time at high temperatures, the heme iron will turn into non-heme iron. And the second is absorption non-heme iron. Non-heme iron accounts for the majority of dietary iron. Non-heme iron is only absorbed 2 until 20% by the body, and its absorption is influenced by a number of circumstances. Dietary iron is also likely to be absorbed as ferritin, an iron storage protein found in animal and plant cells. into intestine cells. Intestinal cells, both heme and non-heme iron, enter the same pool and are processed in the same way. Okay, next.
Hello, my name is Damaghita with last three-digit number 036. So I will explain about the prognosis of iron deficiency anemia. So mostly patients with IDA will have an excellent outcome. It is because IDA disorder actually easily treated disorder. However, poor prognosis may emerge if the underlying causes or comorbid is not well treated, such as neoplasia or coronary artery disease. On the other hand, chronic IDA rarely leads to death, but moderate or severe IDA may cause hypoxia, which can putrefy the underlying disease. For example, cardiovascular or pulmonary disease. This condition may lead to hypoxic death. Although IDA has a potential to have a severe prognosis, the efficacy of IDA treatment from intravenous or oral iron is undoubted and expected. But unfortunately, the adverse effects haven't been explored yet. That's why usually patient that is administered with higher dose should be regularly assessed. Thank you.
Hello, my name is Alamanda Candra with three-digit student ID number 086, and today I will explain about the summary of our student project about iron deficiency anemia. So iron deficiency anemia, or in short IDA, is the most widely known type of hematologic disorder, especially on anemia types, which has reached to 50% cases of all anemia cases. The number of IDA varies depending on age, gender, physiological, pathological, environmental, and socioeconomic factors. The etiology of IDA consists of dietary factors, hemorrhage, hemoglobinuria, malabsorption of iron, and pregnancy. There are several clinical manifestations of IDA are generally shown as brittle nails, spoon nails, or koilonychia. Paleness of the skin are shown as yellow skin, afternoon tongue, and cracks around the lips. Other symptoms include as chest pain, shortness of breath, cold extremities, tongue soreness, tachycardia, headache, exhaustion, sleep disorder, tingling feelings in the legs, or known as restless leg syndrome, alopecia, wheezing in the ears, and pica. But the supporting test is still needed to diagnose iron deficiency anemia. There are several therapies available for treatment, such as iron oral treatment to iron absorption enhancer such as vitamin C. The prognosis of IDA is excellent and easily treatable. Thank you. Okay, this are the references that we use to make our student project. Okay, this is the end of our presentation. Thank you for your time and attention. We apologize if we make any mistakes. We will close this presentation with Parama Santi. Om Santi Santi Om. Wassalamualaikum warahmatullahi wabarakatuh.